I'll tell you that when I went to this lab, I had my knee injected with
Huh.
stem cells, and I have a meniscal tear and arthritis from that meniscal tear, and was looking at a joint replacement. And it's been probably 5 weeks now, and I no longer have fluid in my knee, behind my knee, which is called a Baker cyst. I no longer have pain when I go up and down the stairs. I have a lot more function in a very short amount of time.
This is MedSpa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate D. Together, we explore the wild west of medicine that is the aesthetics industry. Hi, this is Dr. Kate D, and I am back today talking with Judy Rubin. She is an internal medicine doctor who has been practicing for a long time now. I'll let her tell you how long. And she has been practicing aesthetics for almost as long as she's been a doctor. She has a medical spa up in my neck of the woods in the Pacific Northwest, not too far, maybe an hour away, and has been on the podcast a bunch of times before. And today we are talking about the latest hot topic in aesthetics, exosomes, and what they're good for, why are they up and coming, and how are we using them, and what are we waiting for? So, Judy, thanks so much for being back on the podcast today.
Thank you so much for inviting me. I love doing podcasts with you.
It's always been really fun. And I think it would be really great to start with what is an exosome and why is it useful and what do we use it for? What can it be used for? So, do you want to start explaining what an exosome is for people?
Sure. An exosome is a small vesicle created by cells, and it is used for cell-to-cell communication.
Well,
So,
that's the fastest explanation I think
yeah,
I've ever
it's
heard.
kind of like a
And
hormone.
yeah, I mean, I think the way I've explained it before is that back when I was in med school, we didn't know about exosomes, right? And we thought that cells secreted growth factors and hormones, other transmitters, naked that flowed through outside the cell and landed on another cell and caused a signal to happen for the cell to do something. And then somewhere around, I don't know, 20 years ago, maybe, exosomes were discovered. And it turns out that they're not really secreted naked by a cell. They're actually packaged in these little bubbles, these little containers that we're calling vesicles or exosomes. It's a membrane bound thing, but it's not a cell, right? It's a little packet of signals. So it turns out that cells actually use exosomes, not naked molecules, to communicate. So those have been researched for a really long time now, but they've mostly been in laboratories and in academic centers and stuff. So can you talk a little bit about how we're using them and how do you get them, and a little bit about how do you figure out that you've got the right kind of exosome? Because my understanding is that each packet, each little exosome has a different set of messengers. So obviously you want ones with good messages, right? Grow some collagen or repair things, and not any bad messages. Have some inflammation and cause
Yeah.
problems, right?
So,
So how do we know?
so exosomes are like hormones. They're produced in one area and they go someplace else and they have an effect. And that effect is to tell the area that it's going to produce something or to change something. So understanding how injury happens. When you have an injury in your body, let's say in your knee, and you hurt the cartilage, that cartilage puts out its own signals, cytokines, TNF alpha, and the exosomes is attracted to that. The exosome comes over to that messenger in the area where you are hurt, wherever it is, the heart muscle, doesn't matter where it is, and then says, we need to produce, let's say, more heart muscle. We need to make myocardium. And so then stem cells come along and they listen to the instruction from the exosome and they produce more heart muscle, more cartilage, more bone, more skin cells.
So are there good exosomes and bad exosomes, or how do you get the good kind?
Yeah, so we're humans, so we want human exosomes.
Well, for
Certainly there's
sure. Okay, definitely need some from our same species. Okay,
yes,
that's
but
definitely a
there are a
given.
lot of people who are putting plant exosomes into product, but we're not plants. And
Right. I
so you
mean,
want
this goes back to also a lot of skincare products back when I started all this only 10 years ago had plant stem cells in them as though it does anything. And I learned very quickly that, that's ridiculous, right? You put apple stem cells in your skincare, that doesn't do anything, right?
exactly.
So people are doing that with exosomes as well. Is that the deal?
They're doing it with exosomes as well, but I think it's also important to understand stem cells. So do you want to talk about stem cells now or wait until the future?
Okay, well, just so we have it straight here. So the exosomes are the messengers with all these signals inside them. And the
Correct.
stem cells are cells that respond to those signals, right?
Correct.
And do something hopefully good for you.
Yep.
So maybe you can define stem cells for our listeners.
So we have stem cells in our bodies. They're in our fat, they're in our bones, they're in all sorts of secretions, they're everywhere. But the
And there's
stem
different
cells
kinds of stem cells though,
and
right?
and there are different types of stem cells. So there's adipose stem cells, there's bone marrow stem cells, there's cord blood stem cells, mesenchymal stem cells that come from umbilical cord. My stem cells are old. Anyone who is,
Meaning in your body right now floating around. Is that what you're
yeah,
saying?
they don't work very well. So the preferred stem cells to cause regeneration are from the placenta of a baby that was just born.
Yeah.
So we harvest those stem cells from either the umbilical cord or from the cord blood.
Okay, wait, hold on. Let's back up for 1 second for our listeners. So, first of all, a stem cell is a cell that can grow into a different kind of cell, like a cell that does something specific, like a muscle cell or a heart cell, right? And so, the stem cells that we have floating around in our bodies as adults have some but limited capacity to grow into other things, right?
Correct.
So, they might have the ability to grow into a muscle cell, but not, say, a brain cell, let's just say. Okay. And so what we're saying is the ultimate stem cell is something from a fetus, right? That can grow into anything, right? Like obviously, when you have an embryo, it can grow into any kind of cell. That's one, the first cell, and then it divides and it grows into all your other cells. So different stem cells have different capacities, right? So what you're saying is that the cells that you're using in practice are from either placenta or umbilical cord,
Yeah, they're either from the cord blood
cord
or
blood.
from
Yeah.
the umbilical cord. So when you are when you're an egg, the sperm injects the DNA into the egg. That egg is pluripotential. So it divides into 2, 4, 8, 16, gets to a million. The stem cells that are in that, we'll call it blastocyst or zygote, but very early form that is going to form the fetus and the baby are pluripotential. They can become anything.
Right.
Stem cells are multi-potential. They can't become everything. Now, your stem cells and my stem cells floating in our blood, they're multi-potential as well, but they're tired.
Speak for yourself. Okay. Yeah. No, my stem cells are tired too. I'll admit that. Yeah, for sure.
Which is why we use the stem cells that come from a baby that is already born. And it's important to differentiate this because in early medical literature, in early studies, they were using these stem cells from a fetus that had been aborted. These are not aborted stem cells. This is a mother who was scheduled to have a C-section, who didn't want to keep her placenta, who donated her placenta so that FDA approved lab can use it to
Right.
harvest the stem cells and the exosomes. The exosomes are made from the stem cells. And
Yeah.
so when you get the umbilical cord and then you process it to take out the cells that are inside, you're taking out the stem cells and the exosomes made by those stem cells. So that these are extremely vibrant
Got it.
cells, stem cells. The exosomes are not going to divide, that can become many things, but not all things.
So first of all, just to clarify where these are coming from, these are donated placentas that people giving birth are donating to science or donating. I mean, how are they being purchased and made into a product? Do you know?
So they're donated to an FDA approved lab.
Huh?
They're not paid for their donation. And then the lab tests the placenta for many communicable diseases to make sure that it's negative. If there's any communicable disease, it's thrown in the garbage. Then they move on and they have a process where they remove the stem cells and exosomes, put it in a water bath, and then they centrifuge it. The stem cells go to the bottom, the exosomes go to the top. Then they test those stem cells for 2 weeks for sterility, because it's all in a sterile lab that has negative pressure and airlocks in it. And then they check for toxins, endotoxins. If there any of the vials that they make have an endotoxin in it, they throw away the entire lot. So very sterile, very clean.
And
no
how many
disease.
labs are there that are doing this kind of thing that you know?
I don't know the
We
answer
don't
to that
know.
question. Good
Okay.
question. I know that the lab that I purchased my stem cells and exosomes from is FDA approved, and I toured the lab to make sure that it was
It's
extremely
real.
clean and sterile.
Yeah. Yeah. I mean, I remember this is now 20 years ago since my twins are 20, but I remember being asked whether I wanted to either donate or collect the cord blood and keep it like in case somehow that was going to help me someday. Science really wasn't there back then to actually do anything with that, but we've come a long way. Okay. So that's where you're getting it. I have to say that the exosome world. So if you go and call your average med spa across the country, hey, do you have exosomes? Chances are they'll say yes. And then the question is, what kind of exosomes are you getting? Because exosomes are all over the map. So some people are using them again, like from plants. Some people are using ones that are prepared that are just not done properly. So like they're all broken up. They're not whole vesicles. They're not real functional. And so there are a lot of companies that are in the quote unquote exosome business that aren't really producing real exosomes or useful exosomes, and they're not really doing studies on them. There are no exosomes that are FDA approved because it's a biological product, right? It's not a drug.
It's not a drug.
And it's not a device.
Yep.
So as far as I know, there's not a lot of regulation in this area, right? So my understanding is that there are a lot of manufacturers putting exosomes out there that are just a bunch of garbage. So I don't think that they're necessarily harmful, but I don't think they're going to do anything. So I personally, when exosomes started being popular, I was looking into it, and I didn't find anything back then, just a few years ago, that I could count on being quality and useful. Other than that one brand, there's the one brand that makes skincare products. I'll just name it. It's called Plated. And those are platelet derived exosomes. And we know like platelets are involved in healing, and the exosomes that they produce are really helpful, right? They're healing exosomes. And this one company was founded by these two MD, PhD researchers from Mayo Clinic. And they make a topical skincare product. It's not an injectable the way the most of exosomes, we think of them as injectable, right? Or usable in surgery or in injections in joints or skin wound healing and stuff. So I have done a bunch of research in that, but I've not toured an exosome facility or a stem cell facility. So you've done way more research than I have. So I'm curious. So you get your exosomes and stem cells from that one facility. So what are you doing with them now?
So there's lots of applications for exosomes and stem cells. I'll tell you that when I went to this lab, I had my knee injected with stem cells, and I have a meniscal tear and arthritis from that meniscal tear, and was looking at a joint replacement. And it's been probably 5 weeks now, and I no longer have fluid in my knee, behind my knee, which is called a Baker cyst. I no longer have pain when I go up and down the stairs. I have a lot more function in a very short amount of time. So applications for stem cells, injections into joints. You can also use it topically for people who have ulcerations or wounds that are not healing. You can combine cord blood stem cells with exosomes and administer it intravenously. And then you can.
What would you do? What would that do if you're taking it systemically?
So you're using newborn stem cells and exosomes, and you put it in intravenously, and it goes to sites of inflammation. So the exosomes are called to any place where you have inflammation or injury, and then it calls the stem cells to it. So you can use it. It also will go into the brain because it goes through your entire circulation. For me personally, I found that 6 days after I had my IV administration that my mentation was much faster. My ability to learn, my ability to retain.
So you're admitting that you've slowed down a little bit in your
I
old
have
age.
slowed down, yes. But now I have sped
So
up.
wait, did they cross the blood-brain barrier then?
So they are in the circulation. So it's
Mm-hmm.
going to go into your carotid arteries, and then it's going to go to the circle of Willis, and it's going to go to your brain. But if you want to put exosomes into the central nervous system, really the only way to do that is through a spinal tap.
Ah,
Now, there
okay.
is some research on administering it via sphenocath to go across the cribriform plate. So exosomes are tiny. They're 10 nanometers to 100 nanometers in size. And the cribriform plate is permeable to anything less than 400 nanometers in size. So
So
they're
exosomes will get through when
exos-
stem cells shouldn't,
exact,
right? Yeah.
exactly. So you can use exosomes to treat things like Parkinson's disease or someone who's had a stroke or
Well,
patients.
have there been, I mean, if that were true, if there were studies to show that that were really effective, then ultimately that would get approved and actually be covered by insurance.
One would think, but it's not a drug, and there's no drug company.
So
So
nobody's
there's
doing those trials.
there's plenty of literature in articles in the medical literature about stem cells in joints and the regrowth of cartilage. There isn't a preponderance of literature on exosomes other than we need to study this more carefully because there is some reason to study this. There are people, though, who are collecting observational data on patients they've treated with exosome, nebulizing it through the cribriform plate.
Interesting. So what are you using it for in your practice on your patients?
So presently, we are injecting joints and we're doing intravenous stem cells and cord blood stem cells and exosomes. And I have a few patients who are interested in using the sphenocath to put the exosomes, have it percolate through the cribriform plate. But there isn't enough medical literature for me to say you're really going to get a benefit from this. It's really early to say that.
Mm-hmm. Yeah, I mean, with joint injections, we have a long, long history of using PRP in joints, so platelet-rich plasma, and they started doing that. Orthopods started doing that back in the 70s, and because there haven't been enough trials, as far as I know, like it's been many decades, right? But it's still not covered by insurance
They actually came out with a CPT code this year.
this year.
This
Okay.
year, and
It's 2025, just in case someone's listening to this
yeah.
far in the future. And they started doing these injections back in the 70s. So you do the math.
So
It's a
that's
really long time,
now I know the
50 plus
VA
years.
is starting to use PRP for their patients with osteoarthritis. But PRP works because there's 1,000 exosomes in each platelet. But
Oh,
if we put exosomes in with stem cells and inject that into a joint, we're injecting 25 billion exosomes and millions of stem cells. It
right. So it
just will
should be
work
a lot
better
more
than
potent
PRP.
than PRP. Yeah.
Yeah.
Yeah. And so we've had many decades of people just paying out of pocket for this treatment because it works for most people. That, I mean, I've not had it done, so luckily I've made it to my age without having any messed up joints much anyway. It's just interesting to look at the kinds of things that we do in med spas in practice that's sort of outside the system, right? We're a cash-based medical facility, and so what works and what doesn't, and what will people pay for, right? And if you're in pain and you don't want surgery and your insurance covers nothing to help you, people traditionally have been quite readily willing to try a joint injection, and when it works, it's, oh my god, thank goodness. And it's really interesting, this systemic, I have not actually heard of that, to using it for people who are interested in something like this. I would not trust personally anyone except for Judy to do this. I would be really scared. Most places out there are doing IVs totally illegally, and so just be super careful if you're actually interested in pursuing something like this. Find somebody like Judy who can really advise you, and do it safely, because as I've said on this podcast before, there's no quicker way to kill someone than to put something wrong in their IV. So
Absolutely.
sorry, just as an aside.
Yeah. I have an
Uh,
interesting Interesting little anecdote. So there's a famous place in Tijuana that does stem cell injections. And I'm not going to mention their name, but I called them because I was having problems with my knee. And there are very few places where you can get stem cells and exosomes injected. And I asked them specifically, where do you get your stem cells from? Do you check it for sterility? Do you check it for endotoxins? And are you checking the placenta for any kind of communicable diseases? And the answer was, you don't need to worry about that because we're monitored by the Mexican equivalent to the FDA, which, is a
Okay,
bit
that's
scary.
funny. Scary for two reasons. One, the FDA doesn't actually monitor anything here in the United States, it's really quite a misnomer. People don't understand that. The FDA doesn't come and check anybody's facility or their sterility or their quality of their PRP or their exosomes. That's not what they do. And there's just a little part of me that maybe won't trust Mexico as much, although our current FDA isn't doing anything at all to support science. So
Yeah.
not
Well,
really
anywhere you
helping
go in the
at the
world, you
moment.
should get,
So
you
let's
know,
just say you didn't go there.
right, right. And the other thing that I asked them is, I said, I have one joint that I have problems with. It's my knee. It's all I want is my knee injected. Can I come and get my knee injected? And how much will it cost? And the answer is yes, we can inject your knee. It's $19,000, which is far more than it costs in the United States.
19,000.
Correct.
Wow. That's so interesting. I wonder why it's so expensive. So if you
don't know.
go, I'm sure there's other people besides you doing this. I mean, what's the average price for that same thing in the United States right now?
Depends on how many stem cells and exosomes you have injected. But if you have 1 cc of exosomes and 1 cc of stem cells, which is equivalent to, let me get the right number for you. I want to make sure I get this right. It's 15 million stem cells and 25 billion exosomes. It's $3,500.
3,500. Okay. Versus 19,000.
19,000.
Okay. All right. Well, there's one thing people won't be flying to Mexico for, right? At least once this is more widely available in the States.
Yeah.
You're really the only doc that I know who's actively doing this at the moment. I'm sure there are many others, but I don't know anyone who's doing this. Is there anything else? So since we're in the aesthetics business, are you using exosomes or stem cells for skin or skincare or skin
Yeah,
rejuvenation?
absolutely. And we microchannel exosomes into people's skin. So
Mhm.
just like we can buy the plated product that has exosomes in it, but I can buy sterile exosomes and add some normal saline to it and then microchannel it into the skin, which will
Mhm.
increase collagen and elastin much more rapidly than putting it on topically.
Yeah, that's awesome. Well, now I'm curious to know how much that costs.
I haven't really set the price yet.
That's one of the things that has been difficult because most suppliers of these exosomes, even if it's garbage, it's very, very expensive. So people are charging anywhere from 1,500 to 3,500 just to apply one application of exosomes post procedure, whatever. And I personally don't think that is logical at all. It's very expensive. And also, these places are using exosomes that are all broken up and not effective. So it doesn't make sense to spend a lot of money on something that you don't really know is quality, right? So as we talked about, like, it's really important to make sure you're trusting your provider and that they're actually doing all the research for you, because there's no way you can research this and figure out that this facility is producing high quality exosomes.
So I would suggest to anyone
Meaning
who's going to
our
have
listeners.
I would suggest to anyone who's going to have stem cells and exosomes put in their body in any way, shape, or form to ask their provider to provide the information on that product that substantiates the sterility of it, the lack of endotoxins, and the fact that it was tested for communicable diseases. Every patient has that right, and we give that to every patient so they understand that they're safe.
Yeah. I also think it's really important to understand the science behind each use and know that it actually has been studied and not only is safe, but actually does something. We talked about on the podcast last year a case of a stem cell clinic here in the Seattle area that was selling basically useless, very expensive stem cell treatments to people who had no hope with various medical diseases. They were selling it as a cure-all, and those stem cells that they were using were useless. They were garbage. They were all broken up bits. They weren't real cells. They weren't stem cells. And this clinic got shut down ultimately because when COVID hit, they were selling the same treatment as a cure for COVID, which of course it didn't do. But mostly they got caught on consumer fraud charges, right? So it wasn't like medical malpractice or anything, but it was essentially a case of false advertising. And people don't know, right? So if you meet a provider and you trust them and you like them and they're nice, you don't necessarily take their word for it. You should really make sure that what they're telling you is actually true. And this whole stem cell clinic got shut down. They got fined a lot of money. And interestingly, that same doctor did go to practice in Mexico for a while and then reopened a new med spa here in Seattle. So she's back in business and doing the same kind of shenanigans that she was doing before. And so much of what we've talked about on MedSpa Mayhem is how do you know, right? How do you know that the person you're talking to is trustworthy and they're telling you the truth? So I'm curious to know what you would tell our listeners, like what questions should they ask if they're interested in exosome or stem cell injection for a joint or something like that? What questions should they ask to make sure that their provider is really legit?
So, I mean, first, I would want to know, what are their qualifications? Where did you go to school? What was your degree? What was your training? Do you have an active medical license? Have you been trained for this particular procedure? Where did you train for this particular procedure? I would want to know everything about the exosomes and the stem cells. Where does it come from? Show me the sterility testing. Show me the endotoxin levels. Show me the communicable disease testing that was done.
Yeah.
If they're going to inject your joint, are they going to use an ultrasound guided joint technique? So we use ultrasound guided joint injection. I want to see the product go into the right place. That's about it. Oh, you know what? And the other thing is, I never tell people that this is going to fix their problem. This is very early days. Now we have a lot of studies that show that cartilage will regrow in joints that you inject with stem cells and exosomes, but that's not a guarantee. Every person is different. They're going to react to the way that they react. I think it's really important that patients know that this is very early times. And if anyone guarantees them that their joint is no longer going to hurt, that they're going to be healed, that's not the case. There have
It's
been
very
plenty.
experimental still.
It is very experimental still. Certainly for me was worth doing because my copay on a knee replacement would be more than I spent on stem cells and exosomes.
Right.
Not even thinking about the downtime from a surgery.
Yeah. I think that the remarkable thing is what you were saying in the beginning is what's your degree and where'd you go to medical school? I mean, I do think that's really important. This particular person who got shut down, she did go to med school, but she went to med school at a very unusual place in the Caribbean that's not, it is actually affiliated with the Netherlands or something. It was very, very alternative. And then she never did finish her residency and she's not board certified. And the thing is that I'm board certified in radiology, which is completely not related to the thing I do, but it at least proves that I'm a smart person. I got my MD from Yale and I went through residency, and getting board certified in radiology is really, really hard to do. So that's at least proves that I have a brain. There are a lot of people in the industry who are not doctors, who are not even medical providers, who are they're buying products off the internet and they're doing these things. They may or may not even know that what they're doing is illegal. But I will tell you, there are a ton of people trying to sell this kind of treatment and other kinds of treatments as long as you're willing to pay for it. They're willing to take your money. And so I just would be very, very wary of anyone where you weren't really sure about their credentials. So I think that's one of the most important things. And I will say, so Judy and I were talking right before we started recording this today, because a bunch of doctors and lawyers and business people and concerned citizens across the country are starting this new national organization called the MedSpa Board. And we're going to be certifying med spas. And we are going to be asking those questions, and so that consumers will know, do these people have a license? Are they operating legally and ethically and safely? We're not going to rate people and we're not going to guarantee results. Okay. But we're going to ask all those questions. So you ultimately, in the next few months, we're going to launch this, and med spas are going to be able to get a certification from the MedSpa Board. And so hopefully this will catch on. I mean, I know I want to certify my spa. And Judy, I assume you want to certify your spa, right?
Absolutely.
Absolutely. Because we know we are jumping through all the hoops and making sure everything is safe and our license is on the line. A lot of med spas don't even have a doctor, and that's by law, have to have a medical director, but a lot of places don't even have that. So anyway, look for that in the near future. By the time this podcast is out there, I don't know if we'll quite have it rolled out, but it's imminent. So I'm very excited about that. So hopefully we'll have a really cool logo that will be very easily recognizable. If anybody out there is a graphic designer, please call me, because we're in the middle of the process of figuring out what that's going to look like. Anyway,
One of the things that's
sorry, back to
interesting,
exosomes.
one of the things that's really interesting to me, that the states don't regulate the med spas. I think it's fantastic that you're creating this med spa board, but at the same time, I think it's interesting that you, a physician, has had to create this board versus the states themselves who don't regulate the med spas.
Well, they're
And
regulated.
so
They're just not enforced. There's no
yeah,
enforcement. And basically, there's no enforcement until someone's dead. And even those cases that have happened, there have been people dying at med spas. There haven't been any charges filed. And each state is different. All the laws are different. Every single state has a different set of laws. They're similar, but they're all a little different. And so what our goal is to just label the ones that are legally compliant and practicing sound medicine. And that's hard to determine, right? But our goal is to make sure everybody's licensed, that the medical director is doing their job and they're taking responsibility for the medical practice, that it's legally owned, that they're buying legal, legit products, and that they're prepared for emergencies. And unfortunately, there's nobody checking med spas. And there isn't a national organization that does any of this stuff. And one thing I will just make sure everybody understands is this is not policing med spas. This is merely giving people a badge if they are legally compliant. And then they can advertise that they're certified. And we'll have a list of certified spas. And if all the legit places get certified, then that will be a very useful piece of information for consumers. They can tell, and they can still go to the cheap, illegal place. I'm not going to, there's no stick here. There's no punishment for not being certified. But we are hoping that consumers will choose the legit, safe places, and they'll realize, oh gosh, that place down the street, that they're not certified. And when you can call and say, hey, why aren't you guys certified? What's up? And if they can't get certified. But I think that all the legit places, and there are very, very many. I mean, there's a lot of places doing really great work, but it's hard to tell what's the difference between your place and my place and the place down the street that has no doctor within a million miles of it, right? It's really hard for consumers to tell. So that's my hope anyway. That's the dream. And I do feel that I've gotten a ton of positive feedback from other med spa owners. And so I'm very hopeful that people will jump in and get certified. It's not going to be terribly expensive. And that way, this wasn't designed to be a giant money-making company. It's just really hoping to clean up the industry, because the industry is messy. And you and I both really can't stand being associated with the schlocky, shystery people. I mean, I can't stand that. People hear med spa and they think, oh, really? What do you do there? And I want that to be cleaned up. I want it to be recognizable when people are doing really great things. So, and we're at the cutting edge here talking about exosomes. I think that is also, it's at the cutting edge and fringy, right? And traditional medicine tends to poo-poo all fringy things, right? But all innovation happens in that space, right?
Mhm.
And as long as you are doing it in the proper way, right? Then, you can offer something that you just can't get in traditional medicine. And I think that that's where the problems lie, is that the people who are like, oh, well, I can charge money for whatever, then like, how do you trust that? And I think that's why it's really difficult without having any kind of certification process. It's really hard to tell where's the legit place and where it isn't.
Yeah. And speaking about legit versus non-legit, you can buy paralytic agents and fillers on the internet, and you have absolutely no idea where it's coming from. And
Ah,
so we had these non-legitimate med spas that are buying things on the internet, and the greatest number of respiratory depression cases are in spas, and I put that in quotes, who have purchased Botox on the internet because it is not the right concentration.
right.
And if you inject Botox into someone or any paralytic agent that has too much of a concentration in it, it'll cause respiratory arrest.
Yeah. And that was the source of all these headlines this last year of people going to the hospital because of illegal Botox, fake Botox being injected, and it actually caused them to not breathe. Yeah. And there actually have been a couple of arrests this year of estheticians who were buying fake products off the internet. And those, I'm about to give a talk at AmSpa in the next couple of days, and those cases are in my talk because I thought that those were sort of shut down after all the headlines, but they keep going. So there is a little bit of enforcement. But interestingly, though, that's not enforcement because they harmed people or practicing medicine without a license, both of which happened. But it was customs and border control, right? Because they're illegally importing drugs into the United States. So it's interesting because in America, it's basically all about money. Money seems to be way more important than human safety because that's who's actually doing any enforcing. So I find that to be just fascinating. This
Yeah.
is why we're going down this road of trying to do this certification. And my goal is really to have this as a carrot, not a stick. And it's about just advertising and elevating the industry and making sure people know who the good people are, the people trustworthy. Yeah, I'm
Protecting the
very much
public.
hoping this flies.
Yeah, it's
Sorry.
protecting the public. You're protecting the public. I think it's a
Well, we're at
phenomenal
least
idea.
giving the public information upon which to make a decision, right, for themselves. And that's really what we're trying to do in this podcast too, is just give people information because these are really great tools. I think exosomes are really part of the new medicine, right? We're going to be changing a lot of things. We're going to have a lot of treatments like the GLP-1s also in the last couple of years, like changing what medicine looks like, changing what health looks like. But, how is that happening and how quickly is that happening and who can you trust to manage all that for you, right? Because it's complicated, and if you go online and get a GLP-1 and push the dose and there's nobody to help you, you end up in the ER with nausea and vomiting. And so how do you avoid that? How do you avoid the complications? Have you seen any complications so far with your stem cell experience or the exosomes?
No, it's extremely safe. As long as you have a product that is not
So as long
infected,
as
it's sterile,
sorry.
and doesn't have toxins, it's extremely safe because the stem cells and exosomes that come from a newborn baby's placenta do not have any HLA typing. So if you are one type of blood, you're what blood type 1, A, let's say, and you get blood from someone who's blood type B, you're going to have a transfusion reaction because you can't mix A and B blood. However, with stem cells and exosomes, there's no typing, there's no type in crossing. Any person can get exosomes and stem cells from a placenta and not have a bad reaction or any reaction.
I think it's so interesting, and I'm curious to watch as this kind of takes off over the next couple years. I think it's going to change a lot of people's outcomes, so it's very exciting. Can you tell our audience what is the one or two piece of advice you would give them if they're interested in learning more about exosomes and stem cells?
I mean, I do my own research, so I go right to PubMed. PubMed is available to everybody. It's public medicine, National Institutes of Health. Do a search on PubMed for if you have osteoarthritis and stem cells. There's plenty of articles.
But what if they're ready to find someone like you and they're not in the Pacific Northwest?
You can go to R3 Stem Cells. They have providers
Mm.
in many states.
Okay, really interesting. And so, lastly, can you tell everyone how to reach you if they're interested in reaching out to you and your practice?
Sure. They can just look me up in Gig Harbor. Look under Judith Rubin, MD, or nuvomedspas.com. or they can call my office number at 253-358-3667.
All right, cool. Well, Judy, thanks so much for joining me on the podcast today. It's always really fun to talk with you.
Thank you so much.
If you've learned something and like what we're doing, please tell your friends and give us a 5-star rating in your podcast app. If you have a question or a crazy story of your own you'd like to share, please send an email or voice recording to info@drkatedee.com. That's DRKATEDEE.com. Or reach us through the website, MedSpaMayhem.com. And read the book. MedSpa Mayhem is available everywhere books are sold. Thanks for listening. This has been MedSpa Mayhem with Dr. Kate D. We are so grateful you're listening, and we hope you've learned at least one fun or possibly disturbing fact today. Don't forget to hit subscribe on your podcast app and leave us a 5-star review. And read the book. MedSpa Mayhem is available everywhere books are sold. Links and more can be found in the show notes and on medspamayhem.com.